Hello, welcome to this week's 10-Minute 2-Tip Tuesday. I'm your host, Amelia Borland, occupational therapist, owner and founder of Higher Standards Caregiver Training, and we're going to be talking about some really important stuff today. So if you're not familiar with 10-Minute 2-Tip Tuesday, I'm going to give two tips. The first one is for caregivers, and the second is for caregiving organizations. And hint, before we get started, this first one for caregivers is if you are caring for someone who has dementia, whether you're a professional caregiver or a family caregiver, this is absolutely vital information to understand. And on top of that, it's often super misunderstood. I can't tell you the number of circumstances that I've walked into and seen this issue and seen it be misunderstood. So make sure that you watch this one all the way through. Before we get started, this is for educational purposes only. Anything that I say that reminds you of someone you know, someone you work with, maybe even yourself, if it makes you think that that person needs to be assessed or addressed by a licensed healthcare provider, then please make sure they are getting to see that appropriate provider, as this is really and truly for educational purposes only. It's not a substitute for health or medical advice, and it's not a substitute for a therapeutic relationship. Okay, let's jump right in here. So what is this crazy all-important tip for caregivers, specifically of people with dementia? Although, actually, really and truly, I see this misunderstanding most often in people who do have dementia. However, this applies to anyone or any situation. Okay, so here it is. The tip is, people do not just suddenly become more confused or suddenly develop dementia. So see what I'm saying? So a lot of times, this isn't necessarily just related to folks who have dementia. A lot of times I have maybe walked in to see an elderly client, and the person who's caring for them says, oh man, their dementia just started coming on today. And that comes from a couple of different places. One, it's the assumption that everyone gets dementia as they get older, which is absolutely not the case. Many, if not the vast majority of adults, age without getting dementia, although of course dementia is very common. And then the other part of that assumption is that it's normal to become confused, or that if someone has dementia, then it's normal for them to suddenly progress really quickly and become much, much more confused. However, it is never normal to have a sudden change in someone's ability to think. No matter what someone's diagnosis is, no matter what their underlying condition might be, if someone suddenly becomes more confused, that is never normal. And it's always, better safe than sorry. It is always worth, at the very least, putting in a call to the healthcare provider for that person, or notifying whoever needs to be notified that there has been a change in that person's ability to think or that person's ability to function, because these things that is never, ever normal. Again, no matter whether or not someone has a diagnosis of dementia, whatever their kind of baseline status is in terms of their ability to think, their ability to function, having a sudden and drastic change in that ability is never normal and needs to be treated like a potential medical emergency. So that's tip number one. Tip number two today for caregiving organizations. So I think that this is something that we are all guilty of doing. I know I'm personally guilty of doing this. But a lot of times we will tell people not to do something, right? Don't do that. I might be talking to my kids. Don't do that. Put that down, whatever. But I'm not giving them a good behavior to replace the thing that I don't want them to do, right? So we want to think about this when we are, did you see that? Cats are crazy. Cats are crazy. Okay, surprise. So we want to think about this concept when we're providing any sort of input or training to anyone, right? It doesn't matter who that individual is. It doesn't matter what their role is. If we don't want them to do one thing, then we need to give them a different thing to do in place of what we don't want them to do. So a really common example, if I'm telling a caregiver, don't pick someone up from underneath their shoulders, don't pick someone up from their armpits, I can't just say, don't do that. I need to give them a replacement for that action. So otherwise, it's just like, well, you don't want me to do this. Well, how do you want me to do it? And we can't just assume that people are going to know or figure it out on their own because we've told them not to do one thing. We have to tell them what we actually do want them to do. So think about that when you are when you're training any of your staff, not even just your caregivers, but certainly this applies to caregivers, right? When you're training people on for any level of function in your organization, you can't just tell them what not to do if you see something that needs to be corrected. You need to actually tell them what they should be doing. And the best way to prevent getting into that situation from where you're telling just someone constantly, don't do this, don't do this, don't do this, is to train them the correct way that you want things done up front in the first place, the same way for every person every time. That way everyone knows what the expected function or behavior or method is for you in your organization. But that's it. That's tip number 2 today for caregiving organizations. Don't just tell people what not to do. We need to also tell them what we expect them to do. Okay, so that's it. That was a pretty short, I think, 10-minute 2-Tip Tuesday for me today. I don't think we even went 10 minutes, but pretty straightforward stuff, and yet very, very, very important for today. Listen, if you have questions, concerns, if you want to know how to actually accomplish these things in your organization, if you are a family caregiver and you have more questions about these types of care issues, please feel free to reach out. There is also, reach out, leave me a message in the comments, etc., and I'll do my best to answer a question for you. And don't forget that Higher Standards Caregiver Training has a vast amount of resources that are available to you as well. So if there's anything you want to know, any topics that you want me to cover coming up in the next upcoming 10-minute 2-Tip Tuesdays, then please make sure and let me know. Drop in a comment. Also, make sure, September's been crazy all over the place in terms of scheduling, and the rest of the fall isn't getting a whole lot better. Maybe that's a good thing. I don't know. So make sure that you are, wherever you watch this, following, subscribing, liking, etc., so that you make sure you're getting notifications on when the next 10-minute 2-Tip Tuesday is going to drop, so you can get that valuable information. All right, y'all, until next time, please stay healthy, stay well, and most of all, take care. Bye, y'all.